Hi, welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today we're going to talk about emetics, when to use it. So, what is an emetic? It's a pro-vomiting, right, and a stimulating substance to provoke vomiting. And when is it that you need to provoke vomiting? It's basically in cases of intoxication and in cases where you're strong suspicion that your pet has ingested some either human medication or something that could potentially kill them, like, for example, rodenticide, rat poison. And so the timing of when you need to induce vomiting is very important. It has to be case by case, obviously. It has to be you have to know what agent they ingested, because if it's a caustic agent, something that is corrosive like an alkaline or acid thing or a detergent, you don't want them to go again through the esophagus, because it could result in chemical burns and scarring and oh my goodness, it could result in a lifetime of problems swallowing and things like that. But it depends on what it is, and we used to recommend a lot hydrogen peroxide. Hydrogen peroxide, only the 3% solution. If it's higher, it will be worse. But 3% is pretty safe to induce vomiting in dogs. And obviously, when's the time to do it? First of all, once you know what it is that they ingested, then you can actually tell the time. If most ingestion of short-acting medications for humans or pets, like example, eating the whole 6 months of Hargar at one sitting, you can, within 30-40 minutes of ingestion, you can definitely induce vomiting. When it comes to something like rodenticides, rat poisoning, if they've ingested in the morning, even 4 or 5 hours after ingestion, I would still try to take it out, because this is a hard thing to digest, and the most you can take out, the best, chances of not causing bleeding. And some of them are really powerful. I mean, it could be 2 weeks later that you see the symptoms of bleeding, and then it's too late. So definitely, when you can expel the offending substance, that would be better. Obviously, cats and dogs, you can induce vomiting pretty easy as compared to other animals that you should never try. Birds, rodents, rabbits, you should never try to make them vomit. They just can't. They will just aspirate and die. So that would not be a good thing. But for dogs, mainly dogs, which are the troublemakers, and cats, you could use hydrogen peroxide 3% to effect, and try to see if they throw up the offending agent. I often recommend to feed bread, like a couple of pieces of bread, before trying to make them throw up, because the bread acts like a little net when it goes in the stomach, and it kind of like, it will come out with the vomit, but it would come out hopefully grabbing onto whatever substance, especially if it's a drug that is disintegrating. If the drugs are long delay absorption drugs, then you could 5 hours later you could still try to induce vomiting. But most of the things I said within 30 to 40 minutes, that's when is my timing to induce vomiting. Now, we do have other apomorphine is a drug that we use as well, and it's really very effective, and you have to wear gloves and everything to use it, because it can really get you sick. But we usually take them outside and make them run a little bit, because a light exercise can definitely make them more nauseous after they taken the apomorphine or the hydrogen peroxide, and they move it around, then they can definitely throw up. So feed them some bread, walk and running around, and that you will have a much better chance of inducing the vomiting. And why does hydrogen peroxide make you vomit? It actually irritates the oropharynx and the nerves in there, and it causes it's like a mechanical irritation, and it just causes a gag reflex. So I usually use a milliliter per pound, and or to effect, and it's a very successful way of inducing vomiting. The apomorphine, which I mentioned before, it's a pretty cool drug too, and it's an opioid derivative. It's a dopamine agonist, and it just triggers that receptor to throw up. So it's not as effective sometimes. I would say about 90% in my hands. It's sort of like, no, like 90%, yeah. Like 90% for hydrogen peroxide as well. I think for the other drug that we use is Clever. They're drops of ropinirole. It's an ophthalmic solution. You put it in the eyes, and I get those quick. It's like 95% of them just vomits once you put the drop in, and within 10 minutes, we're done. We have saved so many animals from going through surgery when they have ingested socks, they have ingested little tiny toys, they have ingested things that should not have ingested from the household. So we're not just talking about drugs, but sometimes they can throw up a sock, and they can throw up, a piece of clothing or something that they have ingested, a little toy, small enough toy. They can do it because they're at least Clever, to me, they have like explosive vomiting. Whereas hydrogen peroxide and apomorphine, I don't see that. But with Clever, we see them empty their guts good. And so I really think that even though after using all of those things, you can notice that they are like a sour stomach, and they have a little bit of irritation in the esophagus, and the animals don't want to eat. They feel a little bit down the rest of the day and maybe the day after. But my advice would be usually when I induce vomiting, then I usually treat with famotidine or something to kind of calm the nausea, calm the irritation of the esophagus. So now for cats, I use you can actually use xylazine, because when you do xylazine, that's why I don't use xylazine in cats for anesthesia, because they always vomit. So to me, xylazine is pretty good. It's about 50% of the cats can, 55% of the cats will vomit. And another one that you can use for cats is the syrup of ipecac. And this is given for children to induce vomiting. But I think in cats you can actually use it. But again, it's a little bit iffy because it's off-label. It's just we trying to do it. But I really don't recommend it. I've heard that and even posted online. That's what prompted me to talk about emesis, or vomiting, because when you read some articles that are not done by a veterinarian, they recommend such like salt or the ipecac syrup. But these things are off labels and oftentimes might cause worse things than what the ingestion was of the substance was. So I would really recommend to just stick with hydrogen peroxide. I think that's if it's 3% or then it will be or less. It will be a safer thing that you can do at home. Otherwise, take them immediately after ingestion. Call the doctor office, and that can see you, an emergency that can see you right away, and then inform them of what the pet ingested so that they can have the heads up and start doing it. Acupuncture points for nausea that work really good are distal points of the stomach channel. So stomach 43, stomach 42 are really good points to, and stomach 44 are really good points to use to draw the energy of the stomach down. I also like to use large intestine for opens the gate of chi with liver 3. Opening the gate of chi helps move the chi in the body, and that helps the stomach to settle down. So I hope that you learned something today, and I hope you put it to use and hit that notification bell so that you can be aware of all the new episodes that we keep posting every week. Thank you for your support, and see you next episode.